the jury start. All right, first let me make an order. All right. So the order is, what is that called? Jevity 1 cal. Okay, so we're gonna say Jevity, 1 cal, 240 mils via G tube. I'll put TID, which means what? Day, with, we'll say 100 mils free H2O. And it's not that we would charge her for H2O, but it means it's separate from the water that's in the can, right? So in addition to what's in the can, we're gonna give her 100 of water as well. Again, you know, Beacon notwithstanding, with all due respect to Beacon Healthcare, do you guys drink sterile water? Does anybody drink sterile water in here? Okay, where do you drink? Where's the water you get from? Bottled water and tap water, okay? Because the GI tract is not a sterile environment, okay? So, in the nursing homes, and most places, and at home, for people who have tubes at home, they just use tap water. But you wanna make sure the tap water is what? To avoid Mr. Misty brain freeze, right? Or Slurpee brain freeze. Yeah, it's room temperature, okay? Not too hot, not too cold. Okay. So that's my order. I've been in, I've done my head to toe. I come in, I notice the bed's up in the air and the side rail's down, and I write somebody up, Mrs. Kendall. I'm just kidding. But I'm gonna leave that down over there, even though it creeps me out. So I come in, I do hand hygiene, I've done my head to toe, she's doing well. Vital signs are okay. She has active bowel sounds, okay? I wanna make sure she has bowel sounds if I'm gonna give her something to eat, okay? Lungs are clear lung sounds, right? So no indication of any aspiration at this point. I will put up a little bit higher, right? So I come in, I did hand hygiene, privacy, hi. Oh yeah, okay, I'm a Groot. Hi, it's Rick, your Bethel nursing student. I know I was already in to see it today, but can you just remind me your name? And she says, I'm a Groot. And birthday, she tells me, okay? And I'm gonna check that against the MER because it's like a med, okay? So I did hand hygiene, and the first thing I'm gonna do is says, Miss Groot. She says, call me Ima. And I said, actually, I'm gonna stick with Mrs. Groot. Okay, honey. Miss Groot, it's time for breakfast. She said, wonderful. I'll take a Denver omelet. I was like, oh, Mrs. Groot. You're kidding me. I am first going to say, so I got your, I'll get your feeding all right. I have it all the stuff here. And I'm going to first look at the tube. So the tube is up here, and I'll note the condition of the, can't see it there, there it is. The condition of the dressing. Okay, this one has a dressing on it, but I notice that it's in place. There's no indication that it's been yanked or anything. There's no drainage or anything on the dressing is dry and intact. Okay, so it looks good. You having any? There's no signs of distension. You having any GI problems? Any nausea or indigestion or anything? She says, no, honey, I'm starving. Hop to it. I'll say, okay, Ms. Groot. So then I bring in a towel because, as you're gonna see, if you do this skill correct, it's messy. There's no way to do it neat and tidy, okay? As you'll see, and you'll see why at the end. But if you do it correctly, it's messy, okay? All right, so I have all my stuff here. I've got the can. One thing I need is on the wall. I'm gonna grab a couple of gloves. Okay. And what kind of gloves do I get? These are sterile or clean? Clean. Clean, because it's a clean procedure. And clean gloves are for protecting who? You. Me, right? Generally speaking, clean gloves are to protect you. Sterile gloves are to protect the patient. Okay, general rule. Okay, so these are to protect me. So I've got my feeding. longevity 1 cal, okay? I'll note for the checkoff, don't get confused about this, people always do, because the cans will say on them 250, okay? But then the amount is down below. It says 8 fluid ounces, and you know an ounce is 30, so how much is in it? 240, okay, so 240 mils, okay? And it's funny because it always says 237, whatever. But don't get confused by the 250, because the 250 refers to the calories, right? So just saying, just when you're doing your checkoff, don't get confused by the 250, because you're going to think, well, that's too much. But look below, because it'll say 8 fluid ounces, which is 240. Okay. Conditions: cans good, expiration date's good. As it's said in the video, well, I don't have a swabby, but I'm gonna wipe it off with my handkerchief. I'm gonna wipe it off because it's probably been sitting in a warehouse for a while, and rats and roaches and stuff. Crap. Okay, so you want to get off all that stuff. Make sure it's room temperature. I'm gonna shake it up. Now, for me, I like the idea. Not everybody does this. You don't have to do this, but aesthetically. Remember that emotionally and socially, this is their meal time. This is her meal time, okay? And it's already kind of hard to be getting everything through a tube, but to be getting it through a tube from a can just is crass. So for me, you'll see some nurses, this is the right amount. I mean, you could go directly into the tube from the can, but I still like to, for aesthetics reasons, I like to pour it out into another container. That's just me, okay? So I shake it up, I cleaned it off, it's the right stuff, it's the right expiration, and I pour it into this. So it's all in there for feeding,
Do you
okay?
want to pour that before you do something else? Do you want to open that can before you check if you can give the fluid? Check
Oh,
residual?
you mean in terms of check and placement of residual? Yeah, I suppose. But I've already gone there, so I'm going to keep going. So I'm going to get 100 of water from the tap, or per agency policy, right? Make sure it's room temperature. Got that. I've got a Toomey syringe, spelled Toomey. It's a 30 mil syringe with a tapered tip. Okay. And you're going to want one, these should be changed out every day. So if you come into the room and there's an open one there, but there's no date on it, throw it away and get a new one. Okay? If you do open a new one, get a Sharpie and put the date on it. Okay? All right. So we'll say this one has today's date on it. It's good. Okay? And I am good to go. I've got my pH paper. I got everything. I'm good to go. All right. So now I'm going to put on my gloves, and we'll talk about the weather and the Notre Dame football and whatever. Okay, so first I'm going to check placement and residual at the same time, okay? And I've got water and feeding here, and I'm gonna have another empty container in case she's got a lot of residual, okay? Okay. So I'm going to come in here, I'm going to, the head of the bed's up, I'm going to kink it, right? I'm going to open, I'm going to put this on there, okay? Then I can let go because the plunger is in place. I'm going to inject 30 of air, and the purpose of the 30 of air is to move the end of the tube away from the stomach wall and to kind of blow it out, right? You'll note that, and let me just mention this, you can even verbalize this in your checkoff. In the nursing home, the tradition is that you check placement with what we call an air bolus, okay? An air bolus is, if this is in the stomach, theoretically, when you put in that air, you can put your stethoscope on in the left upper quadrant, and you're going to hear a blah, 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 which you will, okay? And that's what nurses still do, especially in long-term care. They'll do an air bolus, and they'll listen for the sound in the left upper quadrant, okay? that, as your book says repeatedly, that is no longer best practices, right? So for the purposes of checkoff, you're going to say, we put in the air bolus just to clear out the end of the tube, not for placement, checking placement, okay? Even though you're going to see that's what nurses do in long-term care, because they don't have the pH paper, right? Anyway, all right, so I clear out the end of the tube. I'm going to pull back on my tube, and my instructor says that I get back about 20 of a grassy green fluid and maybe 10 of air, okay? And then I feel a little tug, okay? When you feel that little tug, that means you've created a vacuum and you've gotten everything out of the stomach, all right? So it's a fasting contents, aspirated contents. It's a grassy green color. That's what I would be consistent with somebody who hasn't had anything to eat all night, okay? I'm going to then put back most of the fluid, not the air. There's no reason to put the air back in. She'll just burp it out anyway. So just put in most of the fluid except for maybe a little bit in the tapered tip, okay? So I'm gonna put back all the fluid except for what's in the tapered tip. I'm gonna kink it off, I'm gonna take it out. I'm going to recap it. Then I'm gonna come over here. I've got a pH paper in there already, and I'm gonna drip it onto the pH paper. And then I'm going to compare. My instructor says you got a pH of 2. Okay, so the pH is it's acidic, so consistent with the fasting aspirated GI contents. It looks right. She's in good shape. No GI problems, no lung issues. Got bowel sounds. So I think I'm pretty good to go. Okay, so those are my cumulative indicators that it's in the right place. So if I pull back and I get 30 of stomach contents, okay, I'd have to kink, put it over here, put it into that container, and then keep going. So you want to keep pulling back until you get that little tug. And when the first time you get a chance to work with a G-tube, you're gonna know what I mean by the tug. You're just gonna feel like it's not pulling back easy, and there's like a little bit of a kind of resistance. That's an indication that you've created that vacuum, that you've gotten everything out, okay? Because you want everything out in terms of residual. You want to know that you've got an accurate measure, as accurate as possible, of what's left in the stomach from the last feeding, okay? So, per agency policy, if I get back, let's say I get back 100 or 200 even, okay? It seems like that would be too much to go ahead with the next feeding, okay? It depends on agency policy. And in your checkoff, you will get an agency policy in the MAR as to what an acceptable residual is to proceed with the feeding. But let's say the agency policy is hold feeding if residual is greater than 200 milliliters, okay? So we would take that 200 and we put it back because her body's still digesting it, okay? In terms of electrolytes and sugars and everything, carbohydrates. So we'd put it back, come back an hour later, check it again. If it's still above 200, then we hold the feeding and contact the prescriber. Because that may be an indication that Mrs. Groot is having some type of delayed gastric emptying, or there's blockage, or who knows what's going on, okay? But that's stuff that you'll probably just have to verbalize. But in our case, residuals, what was the residual in terms of fluid? 20, right? We don't count the air. So it's 20 of fluid, that's our residual. pH good. So I'm gonna proceed with my feeding. So now I'm going to take out the plunger. It's gunky, so I'll let it drip there. All right, now I'm gonna come back over here. I'm gonna kink it off. I'm gonna open it up. And I'm going to put the syringe on there, and I'm gonna hold the kink in the tube, because if I don't, it's gonna be completely open to air. And as she breathes and everything, she'll be sucking down air into her belly, right? So I'm just gonna keep it kinked like that, and I'm gonna start with my water. So I've got 100 in here, but I'm gonna need how much for the flush? 30. So I might as well just do, to make it easy, I'm gonna have to give her all 100, so I could do what and what? 1550, right? So I'll do 50, right? So it goes up to, what is it, goes up, yeah, it goes up to 30.
60 mil syringe.
Oh, these are 60. Oh, okay, 60. Sorry. Did I say 30 earlier for Toomey? Sorry, Toomey's are 60. Gotta correct me. I did that on purpose to make sure you're listening. Okay, so Toomey syringe is 60. So it goes up, I'm gonna put in 50 of water, or thereabouts. It doesn't matter, because I've got all 100 here. So it could be approximately, as long as it's at least 30, okay? Then I'm gonna unkink. I'm gonna let it go down, go down, go down, go down. And right before it gets to the end, I'm gonna stop it, okay? So when you got fluid all the way down to the tapered tip, I'm gonna stop. Because again, I don't want that to be pulling air down into the belly, okay? Then I'm gonna grab my feeding, and I'm gonna go pour, 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 and then I'm gonna unkink, okay? And as it's going down, so pour, 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 pour. If she complains of cramping, how can I slow it down?
Kink it.
I could kink it or lower it. Okay, that'll slow it down a little bit. And then if she said, okay, honey, hurry up, I got my show, and I could speed it up. And then she says, oh, I've got cramps, and I could slow it down. And then I know she's messing with me. Okay, so I'm gonna finish, put all the feeding in, and then it gets down to the end. I'm gonna kink it right before it empties out. Then I'm gonna pour in some water, the rest of the water, and it goes all the way down. I'm gonna stop it right when the tapered tip, it's down to the tapered tip. I'm gonna stop right there to prevent air being sucked down. And this is why you need the towel, because you have fluid left in that little tapered tip. And when you pull it out, it's gonna go right onto the towel. That's what I mean by if you do it right, it's gonna be messy, okay? So then I'm going to cap it off. And at this point, she says, all right, honey, I decided I don't want to watch my show. I want to take a nap. Could you lay me down flat? And I say, no. You need to stay up in this position while your body digests, your breakfast for whatever agency policy is. 30 minutes, 45 minutes, an hour, and whatever your book says. I think it says an hour. It says an hour, okay. And then I would put her down in a safe position, give her a call light, and then I would document. And documentation would include how I verified placement, what the residual was, what the pH was, if I have pH, and how she tolerated the feeding. And that was it. Did I screw up anything else? Thank you. Yeah, so Toomey syringe, Toomey syringe is 60, okay? Toomey syringe, tapered tip, 60 mil syringe. Sorry, Mr. Toomey, wherever you are.
Is that going to be the same syringe for like all tubing?
Yeah, that's standard. Yep,
Okay.
It's standard.
So the end tip still works with like...
Yeah, different tubes. Yeah, it's standard. That's a good question. Do you have another comment?
And you probably said it, but you flush before you started the feeding, right?
Yep, didn't I?
Yeah.
Oh, good, yeah.
I thought I heard it.
Flush at the beginning, flush at the end.
Yeah.
So then I would verbalize. So my instructor says, okay, so let's say you have to give 2 pills, pink and blue, okay? How are you gonna do that? Well, if they're not available in liquid form, I would take each pill, crush them separately, and put them in a cup. Then I would add, is it 30 of water for each one?
Until they're dissolved.
Okay. So up to 30 mils of for each pill.
Up to.
And then I would flush with 30, first pill, let's say blue. Then 15 between, then second pill, then 30 at the end. And then document. Okay. Of course, you did all your 5 writes and 3 checks and everything.
Why are there 2 things coming off the tube?
That's a good question. This is for, this other tail is for air equalization. Is that what it's for? Is it to equalize air? Or is this a second one for suction?
No. The green port is usually the air for inflating the bumper that's inside.
Oh, it's not a bumper, it's not a bolster?
No, most of the G tubes or J tubes have a balloon inside.
Kind of like a Foley.
Like a Foley, that holds it in place, and that's what they use. Now you can have, and I have some out here where it's a 3-port. 3 ports, one is the air to hold inflate that balloon, that's usually done by the physician, okay? The other one is for feedings, and the 3rd port is many times for meds,
Oh, separate med,
separate med,
okay.
okay? And it just means that there's 3 holes that go inside.
You just have to know which one is which.
Yeah, this one's a 3 one.